My name is Angela Hatzku, and I am privileged to be the chair and host of this year's symposium. Our program was inspired by the previous two symposia organized by my esteemed colleague, Dr. Lisa Patel from Stanford University. You will participate in sessions created through an intensive collaboration between student leaders, jointly supported by faculty and staff volunteers from UC Davis, UCSF, and Stanford Schools of Medicine. I would like to express my immense gratitude for the expertise, enthusiasm, and hard work of everyone involved in our organizing committee. I also would like to thank our sponsors for making the organization of this symposium possible. And now I can see that Dr. Susan Murin is online. Am I correct in this?
I'm here, Angela.
Oh, there you are, Susan. Excellent. It is my honor to introduce Dean Susan Murin, Professor of Medicine in the Pulmonary Critical Care and Sleep Division and Interim Dean of the UC Davis School of Medicine. As it has been traditional of the host institution's dean, Susan graciously agreed to deliver the opening remarks for today's symposium. Susan, all yours. Thank you.
Thank you so much, Angela, and welcome everyone. Thank you to the incredible students, faculty, and staff from UC Davis, UCSF, and the Stanford Medical Schools who made today possible. I also want to thank all of our speakers and especially our keynote speaker who's joining us from the UK today. This year, in partnership with the White House, the U.S. Department of Health and Human Services issued a call to action for healthcare institutions to address the climate crisis through a new initiative to reduce emissions across the healthcare sector. I'm pleased to share that UC Davis Health, along with our fellow institutions, signed that pledge. Today's symposium will help to facilitate areas of collaboration, research, and education, as well as advocacy that can all help us toward that goal. UC Davis School of Medicine continues to be at the forefront of climate action, especially in the areas highlighted at today's symposium, including sustainable healthcare, action on the health effects of air pollution and wildfires, and research on climate change and health. UC Davis consistently ranks in the top 10 globally for environmentally conscious campuses. Environmentally conscious design and management guide our current building and growth plans, such as the new building net zero emissions designs of our California Tower and our Aggie Square buildings. I'm also proud to share that 2 of our 4th-year medical students were recently recognized nationally for their leadership of the Second Breath program, which saves unused and discarded medical equipment, rescues it from landfills, and provides it to individuals and organizations that need it locally and worldwide, including Africa and Ukraine. UC Davis is also a national leader in digital health and telehealth, which reduces auto emissions. And we recently implemented a work from home flexibility program, which does the same. I want to thank all of the nurses, doctors, students, and staff on our Sustainable Healthcare Committee, led by Dr. William Pevick, as well, for the hard work they're doing to make UC Davis Health greener. UC Davis School of Medicine is also advancing our knowledge of the impact of climate change on health in several research fronts. We are dedicated to reducing climate injustice by educating healthcare providers to recognize the impact of climate change and empowering our communities to tackle the climate crisis. Under the leadership of Dr. Irva Hertz-Picciotto, we formed a task force to establish the Institute on Climate Change and Human Health to ultimately translate research into effective policies to reduce the health impacts of fires, heat waves, drought, and increases in certain respiratory and infectious diseases. UC Davis is also actively partnering with communities to address structural vulnerability to climate change. For example, our Environmental Health Sciences Center funds community scientist partnerships, such as the Salton Sea Project. The Western Center for Agriculture, led by Dr. Kemp Pinkerton, creates research partnerships with agricultural communities. And the UC Davis Climate Adaptation Research Center partners with community organizations to conduct research and to implement solutions for communities facing climate stressors. However, we know there's much more to do and many more opportunities to pursue. This begins with collaborations like today's NorCal Symposium as a result of the alliance among our 3 medical schools. By working together and leveraging our combined strengths, we can maximize our reach, create new partnerships to protect public health, and respond effectively to urgent climate-related issues. As Greta Thunberg said, "I want you to act as if the house is on fire, because it is." Thanks to all of you for coming together and attempting to start putting out that fire. Enjoy the symposium, and thank you for your partnership.
Thank you, Dean Murrin, for the opening remarks.